The benefits of magnesium. In this video, we shall reveal the benefits of magnesium on stroke, heart disease, and type 2 diabetes. Please remember to hit subscribe, click the bell icon, and select all notifications to receive all future videos on transforming your health. Watch till the end to discover how much magnesium to take and the best sources. If you're looking for a way to decrease your risk of developing coronary heart disease, stroke and type 2 diabetes, research has revealed profound results from starting a simple new habit, consuming an extra 100 milligrams, mg, of magnesium via your food on a daily basis. Researchers at Zhejiang University and Zhengzhou University in China found that more than 1 million people across 9 countries who consumed the most magnesium tested out with a 10% lower risk of coronary heart disease, a 12% lower stroke risk, and a 26% lower risk of type 2 diabetes. Regarding the research, which was published in Biomed Central, lead study author Fudi Wang, PhD, explains in a Medical Express news release 3 that although current guidelines recommend that men take about 300 milligrams of magnesium a day, and women 270 milligrams per day, deficiencies in this mineral are still common, affecting anywhere between 1.5% and 15% of the population. The researchers hope this information serves to not just encourage people to make sure they're getting adequate magnesium, but to prompt policymakers to change dietary guidelines, which could diminish the number of magnesium deficiency-related diseases. Heart issues linked to low magnesium, but science takes a wrong turn. In 2013, the upshot of a groundbreaking review covering what was known about cardiovascular disease from as early as 1937 found that low magnesium levels, not high cholesterol or consumption of too much saturated fat, are the leading cause of many aspects of heart disease. The 10-year review, conducted by research scientist and author Andrea Rozanoff, Ph.D., was based on the earlier research of Dr. Mildred Seelig, who studied the relationship between magnesium and cardiovascular disease for more than 40 years. Seelig noted, as early as 1957, Rozanoff says, it was very clear that low magnesium was, strongly, convincingly, a cause of atherogenesis and the calcification of soft tissues. But this research was widely and immediately ignored as cholesterol and the high saturated fat diet became the culprits to fight. The wrong turn scientists took when the research was so clear, Rozanoff asserts, created a trajectory in the way heart disease and other cardiovascular issues have been dealt with across the board. This resulted in entire populations failing to balance their magnesium intake with their calcium intake, and it's getting worse. Studies continue to show that when calcium and magnesium intake aren't on an even keel, Rozanoff asserts, the risk of heart disease increases. Evidence, much too compelling to ignore. Medical and naturopathic Dr. Carolyn Dean, a member of the Nutritional Magnesium Association's Medical Advisory Board, asserts that it's obvious that cholesterol isn't the cause because statins have been the answer doctors have turned to for their patients for 2 decades. But heart disease is still the #1 killer in America. Although there are many other medical conditions that can be attributed to low magnesium levels, Dean listed 6 of the most debilitating: hypertension, heart arrhythmia, type 2 diabetes, angina, cholesterol level problems, heart attack. Celebrity dietitian Ashley Koff, also a member of Prevention Magazine's advisory board, noted that magnesium has rightfully received increased attention as a critical nutrient in relation to optimal health. Further, she believes that correcting levels of magnesium intake recommendations is one of the most critical health issues today. In a March 2017 study, scientists found that hypertension was inversely associated with magnesium in children living in higher altitude areas of Argentina. Another 3-month, randomized, double-blind, placebo-controlled study revealed that magnesium supplementation improved the metabolic status of obese and pre-diabetic patients with mild cases of chronic kidney disease. What makes magnesium intake so important? Dr. Mehmet Oz, host of the nationally syndicated and Emmy Award-winning Dr. Oz Show, as well as vice chair and professor of surgery at Columbia University, says magnesium is essential for helping regulate metabolism, and it helps lower blood pressure and dilate arteries. Additionally, Oz asserts, arguably 3 out of every 4 people in the U.S. fail to get the amount of magnesium they need. which means they're magnesium deficient. While the World Health Organization, WHO, recommends 400 mg to 500 mg of calcium, Dean advises a 1-to-1 balance with magnesium, with calcium consumed through your diet. Wang's research analyzed data from 40 epidemiological studies from 1999 to 2016, looking at the associations between dietary magnesium and different diseases. All the studies used self-reporting food frequency questionnaires from 24-hour dietary recall to determine magnesium levels, and they varied widely. Biological, lifestyle, gender and study location factors were also taken into account. Afterward, he explained, the researchers performed a dose-response analysis for the effect of each 100 mg per day increase of dietary magnesium. The conclusion of the study reinforced the study conclusion that increased consumption of magnesium-rich foods could be beneficial for overall health. Wang's press release noted, magnesium is vital for human health and normal biological functions including glucose metabolism, protein production and synthesis of nucleic acids such as DNA. Diet is the main source of magnesium as the element can be found in foods such as spices, nuts, beans, cocoa, and green leafy vegetables. Magnesium-rich foods. How to naturally combat heart-related disease. Magnesium is the fourth most abundant mineral in your body, and more than 300 enzymes rely on it to carry out normal muscle and nerve function related to energy, relaxed blood vessels, good teeth and bone formation, and the regulation of insulin and blood sugar levels. 8. Magnesium helps your body detox from toxins and helps synthesize glutathione. It also plays a vital role in your body's mitochondrial performance, and in improving your energy level. One very positive aspect of this mineral is that when your body has taken in the optimal amount, it simply flushes the rest away. Dean, in her book, The Magnesium Miracle, recommends taking 200 mg per day, but parsed out in 2 or 3 doses, as it can have a laxative effect. Other scientists recommend taking almost twice that amount, but age and sex are factors to consider. Foods containing magnesium include spinach, turnip greens, Brussels sprouts, romaine lettuce, nuts and seeds, collard greens, beet greens, kale, raw cacao, fruits and berries, Swiss chard, broccoli, bok choy, avocados, squash, fatty fish, wild-caught Alaskan salmon, and herbs and spices, including chives, coriander, cumin, parsley, mustard seeds. Fennel, basil and cloves also contain high amounts of magnesium, so as you can see, it's easy to include it in your diet. If this video was helpful, share it with your family and friends and save a life.